So I'd like to tell you about why and how I became a chiropractor. I first came across chiropractic when I was actually in junior high school. I was in school one day and I started having this sharp stabbing pain in my ear. And at first, I didn't know really what was going on. I thought maybe I had an ear infection. I remember going to the school nurse and she called my mom, and my mom picked me up and brought me to the pediatrician. The pediatrician proceeded to examine me, and he didn't find anything really wrong. He asked me if I cleaned my ears, Q-tips, and I thought, yeah, of course. Every kid hopefully cleans their ears and gets all the wax, out, and things like that. So he thought maybe that I irritated the eardrum, and so I'd get this sharp stabbing pain that come and go over a day or so, and it'd resolve. And that doctor just gave me some drops the first time. A couple weeks go by and I had another episode that happened, and then my dad picks me up from school again, brings me to acute care, urgent care place, and they do what they do there. They examine you, they do the blood work, they do all this workup, and they come back to my dad and they're like, well, we really don't see anything wrong. There's no ear infection, there's no fever. Well, maybe she's trying to get out of school or faking it to get attention. And at the time, I'm an only child, and I've always been an only child, and it was I liked going to school. I hated missing homework and having to make it up, and my parents knew better. So it was I didn't have any reason to try to fake, getting out of school. But at the time, the medical doctors couldn't figure out what's wrong because they didn't see any things showing up in their tests they were doing. So over the next couple months, I'd have these episodes that come and go, and I kind of would deal with them at times. And finally, my mom brought me to a family doctor, and that family doctor evaluated me, and he started saying the same thing. I don't see ear infection, I don't see anything wrong. And as a junior high, preteen, I decided to stand up and be like, I'm not faking this. This is real. And I got really frustrated with the doctor, and the doctor was really kind, and he was like, well, I believe you. You know what? I noticed you seem like your neck's kind of tight, and your range of motion maybe could be better. Why don't you try to go to a chiropractor? And I'm going to send you not just any chiropractor, but this chiropractor that uses the activator instrument, which is similar to the one I use today. This is actually the 4th generation activator. And so back then it was the 2nd generation activator, a little bit smaller instrument. But anyway, I go to this chiropractor. He evaluates me. The 7 vertebrae in my neck, instead of having all of my neck in alignment, he found 3 or 4 of them out of alignment. So half of my neck was not in the right place. And instead of getting traditional neck pain or headaches, I was experiencing this ear pain. This pain was radiating into my ear. And in the history that the chiropractor was doing, he asked me, did I have any neck injuries or did something before this pain started. And I remember right before the pain kind of started coming on, I remember we were doing gymnastics on those lovely blue mats. I remember doing a headstand and rolling out of it kind of funny and having this burning twinge of pain in my neck. But as a young kid, the pain didn't last very long. It was brief. I remember not having any long-term neck pain, but eventually it started showing up in a different place in my ear. So through the course of history, I started off as a chiropractic patient, and then fast forward into the future, I ended up working for this chiropractor. I got a job as assistant for him, and as I started working with him, I realized it's amazing how the nervous system affects every system of the body, and how it's amazing how it works. And when I worked for him, I was still a freshman in college, so I wasn't really sure I wanted to be a chiropractor. I thought maybe I wanted to be a pharmacist because, I don't know, you pick a major in freshman year of college. And so I worked with him briefly, and then I ended up getting a job with a medical doctor, and started working with pharmacists, and started working with the other side of the drug world and the allopathic world, the medical field, and realized, they really do try, but seeing the contrast working for the chiropractor and people getting better and having that holistic health without any side effects was amazing. And seeing the other side, we need it, but I didn't really gravitate so much to there. I really like to find the cause of problems and try to fix the cause. And so I changed my major, and picked chiropractic, and I really enjoy everything I do, and I get to help patients every day and make them feel happy and healthy. So that's my story.